The situation certainly worsening in Spain, but for a fifth consecutive day, Italy has seen a decreasing amount of cases and deaths have also slowed down. However, there has been a slight increase in cases in the south of Italy, which has so far been spared from any major health crisis. Authorities are scared, however, that there could be a second wave of infections that would in fact hit those southern regions. For more on this topic, we are joined by our Rome correspondent, Seema Gupta. Seema, thank you ever so much for joining us. There are beliefs that if the virus were to spread to southern Italy the way it has in the north, that the repercussions there could be even worse because of a lack of hospitals and doctors, and many of whom have actually travelled north to help in those worst hit areas.
Well, yes. I mean, in general, the south of Italy is not as well equipped as it is up north. Lombardy, the hardest hit region in terms of this COVID-19 virus, is considered one of the most world-class in Italy in terms of its healthcare system. And so there is concern about potential spread there. We are seeing increasing number of clusters in the region around Rome, that's the Lazio region, as well as in Campania, that's the region around the city of Naples. Now, we're seeing clusters particularly in situations like care homes for the aged or long-term care homes, where we're seeing that becomes a particular point of congregation in terms of infections for COVID-19. And the president of the Campania region has made a plea saying that they're concerned that Campania is going to become like Lombardy, and they're asking for more equipment, more beds, more ventilators to be also sent down south so that they're prepared to deal with potential rising numbers. The smaller towns in the south of Italy, some of them are also saying we want the military on the street. We want to contain and make sure people stick to these lockdown measures and don't go out and not increase the spread of the virus. For the most part here in Italy, with the increase in the fines, we do see a slight drop in terms of violations. People are getting the message that they should stay in. We've also just heard from Italy's National Institute of Health, and they've said that the rate of infections does seem to be slowing down since March 20th. We're not near the peak. We're not at a declining phase, but the rate is slowing down. And that's why even more so, it's important to stick to those containment measures. The health officials saying that perhaps the containment measures and the lockdown will be extended beyond the initial deadline of April 3rd. In the meantime, as far as healthcare workers are concerned, who are in the front line of this battle, we're hearing today that at least 44 doctors have died, most of them family doctors, and some 6,205 healthcare workers are infected. Of course, they're at the front line in fighting this disease, this virus, and they need all the protective gear that they can get. We're still waiting for it to arrive to those who need it most, particularly up north, where they're also setting up special COVID hospitals.
Seema, and just very briefly, we know that there's historically quite a lot of rivalry between the north and the south of Italy. Are citizens of the south and the southern regions, are they confident that if the situation worsens, they will get help?
I think people in the south are also, they're concerned about whether they're going to get the help, but they're also concerned about the fact that you had that wave of people from the north who came down south, and whether or not they've declared themselves to be coming from the north and putting themselves in self-isolation. Many have, thousands have, but there is concern whether or not people are coming forward. They are worried whether they're going to get the help. They have been getting it from NGOs as well as from the government to some extent. But perhaps that may not be enough, especially when you see the rate of infection. That's why the government and the health officials have stressed that the key challenge is to ensure that the regions where it does appear to have contained the number of infections, they will continue to remain so. That remains the challenge right now.
Seema Gupta, thank you ever so much for joining us. Alive here, Seema, our correspondent in Rome.